with another engagement. Like we had been looking at the various engagements in the earlier lectures, from where we started with the introduction. We went to the NCP, the nutrition care pathway. We went at those nutrition interventions, the enteros, the parenteral, the peripheral parenteral. We looked at the nutrition assessment. Of late yesterday, we ended looking at the obesity and weight management, and in these we had looked at, actually these are the forms of overnutrition and the categories. We had looked at how we assess for obesity. We had looked at what to do when we face such cases, or when we face clients with such cases, and we had looked at things to do with weight management, and we had looked at how these are being exacerbated by the environment in which we live, the other factors being the genetics predisposing people to this. And also we had looked at ways in which we could counteract these, whereby we are reducing on the amount of calorie that we are pumping into the body to alleviate some of the symptoms that could later bring us to this metabolic syndrome. We looked at other things to do with surgical operations such as the gastric bypasses, the Roxen, and why. Then we looked at a lot of other things there, so as to reduce on the volume of the stomach and the food it has, and also to shorten really the amount of time the food takes in the small intestine, leading to less absorption of the nutrients in question. And we saw that this is something of a trend that is being advanced due to the technological advancements that are taking place here and there. Though now, shifting gears, we are looking at the metabolic syndrome, and now we have started with the first one, which we could call the diabetes mellitus, but we will see others as we go on: the hypertension, the cardiovascular diseases, the liver cirrhosis, and also what people call the fatty liver, etc., as time goes on. And we are saying that diabetes, this is a metabolic disease, or you could call it a condition resulting in from elevated levels of glucose in blood. Okay, yes, and we are saying there is a function in this insulin, whereby we are saying the insulin regulates glucose levels in blood. And statistics show that 1 in 10 individuals is affected by diabetes, with 1 in 5 cases being undiagnosed. And when we talk of undiagnosed, these people are in the dark. They do not know whether they have the diabetes, or really they do not have it. And we have the pre-diabetes, and we are saying this is a precursor to diabetes. Precursor means that is a first step before you get into the diabetes, I should say. And we are saying that the diagnosed cases are more prevalent in older ages and older groups. Some people are talking of inability to secrete enough insulin to regulate the blood glucose levels as someone ages, etc. And also some people are talking of cell walls being damaged, leading to a lot of glucose entering into the cells. A lot has been talked about that, and we are seeing there is a high prevalence among American Indians and Hispanics and non-Hispanic black population, where there is a high prevalence of diabetes in the less educated, or people who have not attained very high levels of education. Because whenever you've not attained these levels of education, you may start to correlate these things with other beliefs that you have, and say maybe someone is dealing with you traditionally or something like that. Okay, and really, this is a slide I wanted us also to There's really not much we can do. But then when it comes to diabetes mellitus, that is more to do with the diets and other things that we can work with in line to see a way on how we can counteract this and also lead to overall well-being of the individuals with this particular condition. And we are saying types of diabetes mellitus. We have diabetes mellitus type 1, and this we are saying occurs when the body does not produce enough insulin. Okay, and we are saying most commonly diagnosed in children and young adults. Really, in diabetes type 1, you will see that the body is not producing enough insulin. And I think there is those reactions. One is to do with glucagon, and then the other one is to do with insulin. Insulin is produced when there is a lot of glucose in blood. Okay, then glucagon is produced when there is low glucose in blood. So glucagon will try to show the body that more is required, more glucose is required, and glucose will be released. So type 2 diabetes, here we are saying this makes up 90% of all diabetic cases, and this occurs when the body does not use the insulin effectively or doesn't produce enough. And this one is often linked to lifestyle factors such as weight and activity level. That's why we were looking at obesity yesterday, because these are some of the predisposing factors to type 2 diabetes mellitus. Well, people could argue that here in type 1 diabetes mellitus, this is where a lot of genetics comes into play, whereby now you can't do much with pushing the body to limits of it producing enough insulin that you want. But for diabetes type 2, here we have all the things at our disposal. People are talking of accumulation of fat around the cell walls, which is also inhibiting the insulin from pumping glucose directly into the cells, leading to overaccumulation of glucose in the blood. Okay. Here we are looking at also another form which we call gestational diabetes, and we are saying, as you could hear from the name, this develops during pregnancy and usually results after childbirth, and this one can increase developing type 2 diabetes later on in life if caution is not taken. All right. Procedures for testing for blood glucose. Okay, so how do we know that one has that the levels of glucose are high, or the levels of blood glucose are high? One of the procedures or one of the methods we would use is by using a glucometer. Okay, and we are saying here to obtain a blood sample via finger prick. Okay, the finger of the individual you're trying to test is pricked. Okay, and then a test strip is used to measure the glucose levels instantly. That is how we could use the glucometer to measure the blood glucose levels of a patient or of a client coming to claim that they have the symptoms of this condition. As we will see later on, some of the conditions that someone will report that will warrant you to do these tests. Okay. All right, then for the continuous glucose monitoring, here we are having the implanted sensor tracks, implanted sensors which track the glucose levels in the interstitial fluid. Okay, then transmitting real-time data wirelessly for monitoring. You know, a lot of things have changed. People have really talked over these smartwatches, that there are now smartwatches that can ably tell you the amount of glucose that you have in your blood, and you really will see that a lot of these advancements, most of them trying to help us with overall health and well-being. Laboratory testing, here we are looking at the healthcare professionals which draw this blood for precise analysis in the lab, and this is commonly used in the diabetes diagnosis and management. Then for the oral glucose tolerance test here, so after the fasting, we will see the fasting blood glucose. When we talk of fasting, people have argued that even after fasting for 8 years, not 8 years, sorry, for 8 hours, people can able get results and also use them as for fasting blood glucose. But earlier on, the practice was that for fasting blood glucose, we need the whole 24 hours and then do that blood test and see the levels of glucose in blood. Right, then also we have this hemoglobin A1C, or you could call it the HbA1c test, and this we are saying it measures the blood sugar levels over the 2 or 3 months, offering an insight into the long-term glucose control for diabetes management. Really, we will see that this one is for the long term, but the one I've been telling you about, the fasting blood glucose, is really for a short term, as we will see later on. And for the self-monitoring of blood glucose, or you could call it the SMBG, here we are looking at the diabetics self-monitoring blood sugar using the meters at home, and also aiding in medication and diet adjustments based on these daily readings. For people who are not really rich or who do not have that money at their disposal, what really they do is they don't have the money to hire a nurse at home. Okay, so what happens is these individuals will start administering these insulin shots to themselves, and this helps in a way that even people who do not have the money on them can ably acquire health care and also be living free of the challenges that come with the diabetes, since you will see them as time goes on in this engagement. We had talked of the gestational diabetes. Really, like I told you, this develops during pregnancy, and remember, with the pregnancy, we are talking about increasing of the number or the volumes of the food we are taking into the body. So when we take in a lot, and now the body cannot produce enough insulin to meet these extra needs during pregnancy, so really we will get this gestational diabetes. In most cases, people are talking of it resolving after someone has given birth, but here we are looking at it increasing both the mother's baby and also the mother's predisposition to diabetes. So it is always key when you're having these pregnant women over to tell them about the gestational diabetes that could come up. So really, we are also looking at understanding the blood glucose levels, okay? And we are saying, like I told you, glucose earlier on is the primary source of energy to individuals or to humans. And we are saying that the glucose levels with normal fasting blood glucose are ranging from 70 to 100 milligrams per deciliter, okay? Yeah, and so for hyperglycemia, or you could call them high blood sugar or high levels of sugar in blood, these are above 126 milligrams per deciliter, and these may indicate diabetes. While for hypoglycemia, which we also term as a low blood sugar, we say this can cause symptoms like shakiness and confusion, and also regular monitoring and appropriate management are crucial for maintaining optimal glucose levels for overall health. We don't want it to be very low, and we don't want it to be very high. With low glycemic index, then that means remember, the energy is required for your body to do all activities, even the breathing, even the walking, even the muscle contractions, etc. All these require energy, and if the energy is not there, we'll have a lot of problems with the body. So we want to maintain that optimum between the normal ranges of 70 to 100 milligrams per deciliter of blood. Okay. What are the symptoms of diabetes? So when someone comes knocking on your door in your consultation room or in your office, and then these are the things they are reporting, they are talking of the increased thirst and urination, they are talking of fatigue, they're talking of blood vision, they're talking of slow healing wounds, as we will see. They are also talking of weight loss that is always in type 1 diabetes. Why are we saying weight loss in type 1 diabetes? We're saying weight loss in type 1 diabetes because the body is not producing enough insulin. Okay, then in type 2 diabetes, the insulin is there, but then it is not just enough or it is not adequate. So you will see a weight gain in the type 2 diabetes mellitus, I should say. So if someone comes to your consultation room presenting with this, you should be able to ascertain, maybe ask this person to go and take more tests from the lab. Really, the most common complication here that people always report with is the slow wound healing. Okay, and here this can the diabetes will affect the body's ability to heal wounds, and also it can damage some vessels and also impair the functioning of the immune system. This is where people talk of the neuropathy or nerve damage that the diabetes causes, making it harder for the body to notice the injuries or the wounds. Okay, remember the body needs to notice that now there is a puncture on me. Let me bring the antibodies and everything to fight the thromboplastins and etc. I think we'll talk about wound healing later. But yeah, all those need to be secreted for real active wound healing. But if it's not done during this neuropathy that is caused during diabetes, then we'll have delayed wound healing. So what is the importance of nutrition in managing diabetes? Like we saw, for diabetes type 1, okay, not a lot can be done, but then we'll find ways of going around it. But for diabetes type 2, where this comes from really weight gain, where we are putting in a lot of sugar or a lot of calories or a lot of fat into the body, really food choices can directly impact these blood sugar levels. Okay, when the levels go high, then we'll have to reduce on the amount. This is where calorie counting comes in, things to do with a glycemic index, as we will see later on. And also the healthy eating helps control the blood sugar, manage weight, and also reduce the risks of complications. I think most of us have had complications of the diabetes, such as the diabetic foot and etc., where people have been amputated. Because of this condition. And also, we are talking of the personalized meal plans, which are key to successfully manage the diabetes. So, tips for healthy eating with the diabetes: focus on the whole and unprocessed foods. Really, we understand that these whole and unprocessed foods have that ability of low glycemic index. But we will get there, but let me make it clear here that when we talk of glycemic index, we are looking at the rate at which the foods are able to release the sugar into blood. Okay, so when we talk of the foods that are having a low glycemic index or a high glycemic index, for the low glycemic index, we are looking at foods that are releasing the glucose slowly into the bloodstream. But then for the foods with a higher glycemic index, we are looking at those foods that really will cause these spikes in glucose the moment you eat them. That is always a characteristic of these highly refined foods or the highly processed foods. But for these whole foods or the unprocessed foods, the foods that are rich in fiber, you will see that they are releasing the glucose slowly in blood. And also, we are looking for you to choose the lean protein sources like fish, chicken without the skin, and also the beans. These unlike the fatty cuts from the meats, people who enjoy mutton, people who enjoy pork, yeah, surely these are not good choices for a person who has diabetes and is fighting with that condition. Uh, Also, we are talking of you limiting these sugary drinks and the processed food, like we told, and also including plenty of fruits and vegetables, and also pay attention to portion sizes. Please and please pay attention to portion sizes. Okay, and not only portion sizes, because there this happens in two ways. We could talk of portion sizes. Okay, but then the person is eating regularly. Now there is what we call meal frequency. The frequency of the meals is more. We could say, okay, this person is eating less at one sitting, but then the person is eating a lot at the end of the day because they have breakfast, then they have a snack, then they have two snacks after that snack, then they will have ice cream, then they will have a beverage, maybe a soda, then they will go for lunch. Then after lunch, okay, maybe we are blessed and someone has accepted to take a fruit, but even the fruit juice will have a lot of sugar. At the end of the day, they will have to eat a cookie before dinner. Then they will go and eat dinner. Then they will go and eat supper. They will eat a number of meals and we'll see that then the meal frequencies are not however much I will talk to the qualities. Then also read the food labels carefully. For the foods that have a lot of sugars or the foods that are going to give you a lot of calories, please avoid them. Okay. And also look for healthier options. And also look at actually there is something to do with the substitutes for sugars. I'm really forgetting what it is called, but I will talk about it when we remember. That is why yesterday we were talking about the Coke Zeros, okay, that Coca-Cola company is trying to put out. They've realized that now people are well versed with the understanding of these sweeteners and their ill health that it brings them. So people are really looking at other forms. People are resorting to honey instead, and they're using honey in tea. Although a lot of research still needs to be done with the honey, but really it is proving to be a healthier option compared to sugar. So type 1 diabetes, like I said, this is a chronic autoimmune disease. And when we talk of autoimmune, here we are talking about the body failing to recognize that the cells or itself. There are a lot of autoimmune diseases. If you get interested in that, you will go and look at it, and it has been able to do a lot of damage. Autoimmune diseases have been found to lead to blindness, okay, because the body will start fighting itself. It will start secreting antibodies against itself. So this is what happens in type 1, whereby the body's immune system fails to recognize the insulin producing cells as part of its own. So it will secrete cells to fight against these beta cells that are located in the pancreas. And remember, without insulin, the body cannot properly utilize glucose for energy, leading to high blood sugar levels. So we at least should be able to talk of that the body is just failing to recognize these insulin producing cells as one of its own, thus leading to elevated levels of blood glucose, since now the glucose, the insulin is no longer secreted to regulate it. And we are saying really the exact cause is really unknown, but it is believed to be a multifactorial, or when we talk of multifactorial, a number of factors that come into play. Okay, yeah, people are talking of genetic predisposition, like I told you here, certainly genes susceptibility. If someone had this autoimmune disease in your lineage, then maybe someone later on down the line might have also this autoimmune disease that will lead to the type 1 diabetes. And also we'll also look at the environmental triggers such as viruses, infections. Then we'll also look at dietary factors which could also play a role. And also an autoimmune attack. Here the immune system attacks beta cells and also mistakenly identifies them as harmful. People are talking of other diseases that really leave a similar memory. Remember, they are what we call the T cells, and the T cells these are cells that are secreted, and the memory T cells keep a memory of what that particular antigen has been. Okay, so they might keep it in form of a shape, they might keep it in form of a configuration. So the next time this is secreted, they will come and fight against it. So this is where the problem comes, that the body will, the T cells of the body, the memory T cells will fail to remember, or they will see this looking at the configuration or looking at the shape of these beta cells and say, oh, this really looks like the antigen we fought some time back. So this autoimmune response will be geared. etc. So manifestation of type 1, we are saying often the onset is rapid, okay, and symptoms appear quickly, typically diagnosed in childhood or young adulthood. And it can also occur at any age. You can't say you're really safe from it. And it is insulin dependence. Okay, so this requires a long life insulin injections to pump therapy majorly into blood. This is what I was saying, that now people are well versed with how they can give themselves the insulin shots, because you could feel all these signs and symptoms coming to you, the fatigue and everything happening. So you need an insulin boost. So you will have to put insulin, so that now the insulin can help you pump the blood, the glucose into the cells. So symptoms here we are looking at the increased thirst, urination, fatigue, blood vision, and also unexplained weight loss in these individuals. So for the diagnosis, like I told you earlier on, and here we are looking at also other levels for the fasting blood glucose, the hemoglobin A1C or the HbA1c, like I told you. Here we are looking at the levels being interpreted based on the established ranges. And for the normal, we are looking at the percentage of this hemoglobin A1C being 5 to 7%. Then for the pre-diabetes, 5 to 7% to 6.4%. Then we could say this person has higher chances of developing diabetes. And then for the diabetic, we are looking at 6.5% or higher. Then the random sugar tests may also be urgent in these situations, and also testing may be repeated to confirm the diagnosis or the diagnosis, because in most cases we might take wrong readings. So we need at least to come up with these averages really to be able to ably say that this person is diabetic or not. You could say someone who is just having that one time when the insulin is not being secreted into their body. Then for you, you take it as you take it as guarantee that this person has diabetes, but then in the end they are not. And remember, then you need to be giving this person these insulin shots daily, and then you will be counteracting the glucose that the person has of the normal ranges. So in management, we are looking at long life insulin therapy. Like I told you, the health diets and regular physical activities are crucial for blood sugar control. And also, we're talking of blood sugar monitoring, self-monitoring, using the glucometers to track these levels. Really, these are small machines. I will get you a picture later on if this comes up, showing you how these small machines look like. And also looking at the regular healthcare checkups and medication adjustments as needed. Okay. I think this is where we talk of the medications, the beta blockers. People with a medical background, I think, know this. The beta blocker is to do with blocking these beta cells from producing the insulin. etc. You will be introduced to those when you're doing immunology later on. So for diabetes type 2, still this is multifactorial, but really we have this genetic predisposition, but really things to do in general with the environmental factors and the lifestyle choices. Okay, we are not saying you having diabetes type 2 is a crime, but it is more of a person's making. Okay, compared to type 1 diabetes. For type 1 diabetes, you can never know when this autoimmune disease will come. Okay, you can never know. You can be actually doing well in your early 20s, even in your 30s, you're doing well. But then this onset of the autoimmune disease comes up later on due to the viruses that are now the memory T cells are thinking are now your beta cells, etc. But then for this type 2 diabetes, really we are looking at where the body cells resist insulin effects, okay, leading to higher blood sugar, and also insulin insufficiency. Looking at the pancreas may not be able to produce enough insulin for the amount of glucose that you have in your blood. And we are saying its characteristics, this develops gradually. Unlike for the type 1 diabetes, where we say that one has a quite early onset, that then you will see the signs and symptoms developing rapidly. But for the type 2 diabetes, you will see this develops gradually, and symptoms may be mild or absent initially. You could have the diabetes, but you could not have these signs and symptoms of the diabetes type 2. So what are the common symptoms? Here still it is the increased thirst, the urination, the fatigue, the blood vision. And you cannot always tell, but then we saw something to do with the weight. There is weight gain in type 2 diabetes, and there is weight loss in type 1 diabetes and etc. And mostly this is diagnosed through blood sugar tests such as fasting blood glucose test, and also the hemoglobin A1C or the HbA1c test. So what are the nutrition considerations for type 2 diabetes? Focus on whole and unprocessed foods. Not a lot of things change here. Still the fruits and vegetables, the whole grains, the lean protein and the health fats. Limit refined carbohydrates. When we talk of refined, we are not only talking about what you're purchasing, the snacks you're purchasing, but even at home. Limit from you cooking your homemade chips, because when you talk of refined, you're thinking of the industries and what. No, even at home we have those small processing that we do that really use a lot of butter, use a lot of margarine, the ghee that people are using. Everyone is doing cheese these days. I don't know how that started, but yeah, really, in our African setting, maybe a few tribes had it, those that were cattle keepers, but now ghee is everywhere, and also cheese is everywhere. Yeah, and these are the foods that really will predispose us to these conditions. If I'm not saying let's avoid them totally. Actually, in nutrition, we have what we call customizing. For everything, you can never tell a client, even if a client is diabetic, even if a client has whatever condition, you cannot tell a client, do away with this. Okay, what we usually talk about is regulation. It is in medicine that the language is different. In medicine, it is a do or die. But in nutrition, there is a little leeway when it comes to some things. We can tell you reduce, regulate. And when we regulate, we are telling you, you won't have it every time the way you've been having it. If you've been having it 7 days a week, then let's have it 2 days. Actually, we could begin with having it 6 days. You know, a step is more than not taking a step. That is why even when we are talking about the chances we take in life, there is no answer. For example, for people who are looking for jobs and for people who don't have the jobs yet, but you want to get to that place. Really, opening a door and knocking at someone's office, asking for that person to see through your CV. I don't know. There is no biggest. The only thing that person can say is no. Okay, and no is not very bad. Trust me. So, taking this as advice, open every door that you're faced with. Go knock on someone's door. Ask them. The only biggest thing they can do to you is say no. They can't kill you. Okay. And I know we fear death a lot, and even some people even don't fear death. That's why you see in the Middle East and also those some people are doing those extremist acts. But really, the only thing people can say is no. So really, any step that you take in your life, bringing it back to our nutrition here, even if you're counseling a client, and this client can only limit this intake for only a day, let's celebrate that as a success. People really are suffering with food. It is because you're not suffering with it that's why you think things are going to be easier, and you are quick at judging people and telling them you man overeat, you man overeat, you eat a lot of ice cream and etc. But people are suffering with this thing. It is like the other things that people are suffering with. People are suffering with alcohol abuse. People are suffering with pornography. People can't take a day without watching pornography on their phones. These are the same things that it is in the mindset of the individual. So all steps that a person shows that they're willing to change and live a more healthier life, please appreciate them. Okay, even if it is just a day, even if it's from that day is when we'll be able to tell someone, okay, now take 2 days, then take 3 days, then take 4 days of your choosing. You can't tell a person, okay, now what we are going to do is we are going to be eating well we are going to be eating only cabbage from Monday to Friday, and it's only weekends that you will be allowed to go and eat. No. Let a person have the choices. Tell them, okay, which days do you feel you will be comfortable eating more fruits and vegetables in your menu? Then you design a meal plan accordingly. That is why it is very rare for you to see people who design these diets pumping. You won't see these drastic changes, but the changes have to be gradual. Enough has been said about that. So also choose healthy fats, the avocados, the oil in avocado, the olive oil that promote heart health, the omega-3 in the fish, etc. Then read food labels and monitor the portion sizes, the sugar contents, and also the calories. And also this individualized approach. Consult a registered dietitian for the personalized guidance. Okay. Why we say personalized is because everyone has different characteristics, or everyone, we may be suffering the same condition, but we are suffering it differently. Okay, you could be a diabetic, but then you can do physical activity. I could be a diabetic and I can't do physical activity. Okay, what if I'm a diabetic and I'm a disabled at the same time? Are you seeing how the dynamics of our care is going to change and how interventions are going to be different from one person to another? Then mastering the glycemic game. This is where we talk of the glycemic index. And I told you the glycemic index is at the rate at which the food is releasing the calories. So rank carbohydrates containing foods based on their blood sugar impact. Okay, yeah, this is where the calorie counting comes in. For the glycemic load, here we are saying consider glycemic index and portion sizes, offering a more comprehensive picture. Carbohydrate counting, track carbohydrates intake to calculate the insulin dosage. For how much, for this intake of carbohydrate, how much insulin will be required at the end of the day. For fiber intake, then let's promote satiety and also slow down the digestion, which aids blood sugar control. We all know that fiber intake brings this pseudo satiety. An individual will feel satisfied even if they are not. And what does fiber have? In most cases, fiber doesn't have calorie in it. Okay, so then the body will take in nothing, and what it has been eaten the digestion will be slow. When digestion is slow, what happens? There is slow absorption, and when slow absorption is there, a little glucose will be seeping into blood slowly. And what is seeping into blood is what the body is using. So there will be a continuous supply, but there won't be elevated levels of this. All right. So keys to improving health or improved health, maintaining a healthy weight. This we've talked of. Reduce stress on the pancreas. Okay. And also improve the insulin sensitivity. We're reducing the stress on the pancreas because the pancreas is the area that has these beta cells that are responsible for producing the insulin. And also this will help us in improving the insulin sensitivity, and also strategies for weight loss or management, the portion controls, mindful eating, and physical activity. I've told you there is a whole course on physical activity and how we should do it. Remember, if for these people who are diabetic, really, if you put them on strenuous exercises, you will see the individual fainting, yet you wanted to control the sugar level. So it should be personalized and tailored to suit this person needs. Small sustainable changes and gradual modification yield lasting results. I've explained this, and hopefully you can take it not only for the diabetic management, you can take it also in your life. Have something to celebrate every week, okay? Even if it is just reading a single topic, even if it's just reading a book. For people who want to become more computer literate, even if it is just writing 2 lines of code or 1 line of code, even if it is just understanding how Excel works, those successes, celebrate them. Go out, have fun, go and dance, go and swim, go and have a drink of your liking, because later on you will see that you will be building on these successes slowly. But whenever you don't treat yourself, your body or your mind won't want more. Trust me, our minds are more geared towards prizes. That is why you see we strive for more things. But if you reward your mind every time, it will start thinking more so that it gets more rewards. I hope we understand that. Then what are the causes? Like I had talked of this for the causes of type 2 diabetes mellitus, but really the people have argued that there could be something to do with the genetics. Having a family history increases your risk of also you getting the diabetes type 2. Then also the lifestyle, excess weight, the obesity we saw yesterday, physical inactivity, unhealthy diet, the smoking, etc. Then the ethnicity, certain ethnicities have a risk to have a higher risk of getting this diabetes, and also the age. And we are saying the risk increases with age. The risk of diabetes type 2 increases with age. Okay. People have argued that really when the age increases now, the insulin that is being produced also reduces, and then there will be a lot of sugar in blood and less being pumped into the cells. So the exact cause still here, it's not understood. But even if the cause is really not known, for the things we can try and work on, things for people who have done a little of epidemiology, we know there are a lot of factors that contribute to a particular disease. There are mediating factors, there are other things to do with the confounders and etc. But really, we can't always associate. There is always we can just associate, but we can't have any conclusive evidence that A causes B, because there are a lot of various factors unless it is known, and a lot of research has been done on it. So the exact cause is not fully understood, but interplay of these factors plays a role. So what are the symptoms? The increased thirst and urination, fatigue, slowed wound healing, like I told you, the weight loss, and also diagnosis being done through the HbA1c. Characteristics self-diets play a crucial role in this, and the focusing on these, like I told you, is key. So symptoms still looks like these are repeated slides, surely. Limit refined carbohydrates, the sugary drinks, the white bread, the pastry, the sugary beverages. Read food labels carefully. Monitor portion sizes, the sugar contents, and the carbohydrates. Okay. So here, when we are talking of the refined foods, this was just another expounding on these. For the refined carbohydrates, we are talking of these being the grains that are processed and their fiber has been removed, and also the vitamins and minerals. Okay, yeah. In most cases, when we talk of these, we are talking of we are looking at uh, France here we call it number one, that posho, the very white posho that is even not cream, or the very white maize flour. People call it posho maize flour, whatever. But I hope you understand what I'm talking of. That very white flour, for us here we call it nambe or number one, like direct translation to English. That's what we call the highly refined. That now even the brand has been removed, all the outer covering has been removed, and we know the more you peel a food, or the more you take out from a food, the more you're losing the minerals and the nutrients that are contained in that food. And we are saying they are found in white bread, white rice and pasta, the refined flour, the sugary snacks, and also the pastries. And we are saying these foods have a high glycemic index, like I told you, which leads to a quick and blood sugar spikes, potentially fostering weight gain and insulin resistance. Also, we are saying they are low nutrients. Okay, I hope you still remember, or some of you have come across things when we talk of empty calories. Okay, when we talk of empty calories, we are saying these are foods that only give us calories. Uh, that is only giving us one nutrient. Okay, uh, for example, I don't want to use beverages, but I feel myself drawn to using Coca-Cola every time. But yeah, when we talk of, okay, let's use highly refined refined maize flour. Highly refined maize flour has now those minerals and calories. That is why people are talking of fortification of maize. For every meal that is producing 10,000 tons, I'm not so sure. It is required as a mandate here in Uganda to fortify, okay, the maize flour, so that something else can be added, so that you're not being delivered with only empty calories. We call them empty not because they are not the calories are not in that contained in that food, but we call them empty because they are the food is only the vehicle, or the food that we are eating is only giving us calories and nothing else. All right. We are also talking of low in nutrients and refined carbohydrates may trigger cravings and overconsumption, and also elevate risks of chronic diseases, the type 2 diabetes, and also the heart disease. Opting for grains and unprocessed carbohydrates can enhance overall health and maintain stable blood sugar levels. And also, the high glycemic index options cause rapid blood sugar spikes. This we are talked of. Really, now this is where I want us to always be the people who are thinking. For our people who have not gotten this knowledge about how diabetes works, you will hear self-proclaimed healers or herbalists telling you that, okay, now for me, I have a medication, or I have these herbs that people can take and they will get cured of diabetes. People will take and get cured of hypertension. Uh, I don't know whether you people have understood or gone ahead and read about what we call a placebo effect. In short, when we talk about placebo effect, we are talking about when people are doing these control trials, we have a group that we give a placebo, then a placebo is that inactive ingredient. Then we have another group that we give the active ingredient, okay, or what we call a treatment group or etc. But then for you will see that there will be results in the placebo group, unexplained results coming into the placebo group. You understand that you didn't give them for example, vitamin C. We are looking at vitamin C and let's say cough, or let's say whatever ailment it is, flu or etc. And we want to see its role in that. Okay, yeah. But then the other side, you will see that the person who is not having an active ingredient, or who is not getting the active ingredient, they are healing faster even compared to the people who are having an active ingredient. That's what we call a placebo effect. So the placebo effect works in a way. There is not a lot of information about it or explanation about it, but this is what most of the challenges scientists face, and still they have to go back to God, and God is the only one with the explanations about this. Because in the normal way, we expect the group that got the active ingredient to be doing far better compared to the group that got the placebo. But if the group that got the placebo is doing far better, then we can't explain it. So this is where these herbalists come in. Okay, the herbalist will come and confuse a diabetic client that the drug or that bottle or that contains that concoction or that liquid is having healing properties. And trust me, this person will maybe mentally be reprogrammed, and these people will become well. And people will start telling you that now I'm cured of diabetes. But then there is no scientific proof that this condition will go away totally. Okay? However, we'll have limited, we will be able to control it, but we are not saying this condition will go away totally. So really, let's be on the lookout for these quacks and sensitize our people out there. But let's not go attacking them because they have successes. They have well-proven successes that they've done their things and their things have worked. However, we cannot explain it, only talk about the placebo effect. And we're saying that glycemic index, we talked of this assessing how rapidly carbohydrates in food elevate these sugar levels. And foods we are saying that foods with high glycemic index of 70 or above prompt quick spikes. And this really, we are talking of all those foods, and we are saying conversely, the low glycemic index foods such as whole grains, legumes, fruits, and vegetables offer sustained energy and promote the feeling of fullness, because really this is more of a feedback mechanism. Whenever you weak, you will be hungry, like it or not, because you want to replenish the energy levels in the body. And also, we are saying that opting for foods with a lower glycemic index can aid in blood sugar management and also enhance satiety and also bolster the overall health of an individual. Why does control matter at the end of the day? We are saying consuming appropriate proportions prevents overeating and also maintains the healthy blood levels. When you don't, you realize you don't need a supper that day, please don't eat it. Why are you putting in food that really you don't need, that you're going to just be giving your body a lot of work to do? Okay, you've just come from a party, you've eaten, but then because you and your husband have prepared food at home, you're going to be forced to eat again. And okay, what happens if you're going to have parties for, let's say, a month? You're going to be in these workshops for a month. What I know is in workshops, some people really go to only eat. Okay, whenever FAO calls you, you go and eat. Whenever WFP calls you, go and eat. Whenever ACF calls you, go and eat. Save the Children, you go and eat. All those are NGOs. Whenever you call, you go and eat. At the end of the day, you will see that the nutritionists themselves are suffering with diabetes compared to the person who even has very little or no knowledge about nutrition. Excessive calorie intake can contribute to weight gain, further challenging the diabetes mellitus. And we are saying smaller portions promote satiety, and also we are talking of prevent feelings of deprivation and also leading to sustainable eating habits. When we talk of smaller portions, really with quantities, this could be something. But then when we talk of the frequencies, still you could work with the proportions and frequencies. And also there is this famous term that the British use of, I don't want to use it this way, but then I think you can pick from it, that an idle mind is a devil's workshop. Okay, that when you're idle, you will think of doing other things. When I'm idle, I will think of going to drink. And when I drink, what happens? I'm putting in a lot of extra calories. One bottle of beer has close to 2,000 kilocalories in it. And if it is 2,000 kilocalories, the recommended dietary allowance for kilocalories for a normal meal is around 2,500 and above. If only a bottle of beer is giving me close to what I need for the whole day, just imagine. That is why you see people who drink are having these swollen bellies and etc. And also on top of that, they are damaging the liver, okay, causing fatty liver and liver cirrhosis, whereby a lot of things will be happening. Now the liver cannot turn the glucose into glycogen. Then there will be elevated levels of glucose and etc. Alright, so choosing the lean protein sources being our second last slide, we are saying proteins play a crucial role in building and repairing of tissues and also managing blood sugar and also promoting satiety. The proteins in managing blood sugar, we are looking at that sparing effect, okay, of the proteins. And also we are saying the lean proteins, the lean protein sources. Really, when we talk of the proteins, remember when we put in the proteins into the body, the proteins cannot be stored in the body, unlike the carbohydrates. So if we realize there is a lot of glucose, or there is a lot of fat from which the body can choose on as the energy source before we get into the ketoacidosis and the ketone body is developing, really we can be feeding this person on only proteins, since the body will take the amount of proteins it wants and the rest will be expelled out, and also still the person will have that feeling of satiety. For the lean protein sources, these are low in saturated fat and cholesterol, promoting heart health. And for the examples, we have the fish, the skinless chicken and turkey, the beans, lentils, the eggs, the low-fat dairy products, the Greek yogurt, and the cottage cheese. I remember we did some cheese lessons, I should say, some time back. Hopefully, you remember. The protein intake recommendations, we are saying the individual protein needs vary based on factors like the age, activity levels, and weight. And also, we are saying a general recommendation is 0.8 grams of protein per kilogram body weight of an individual. And we are also saying please consult a registered dietitian or healthcare professional for the personalized guidance. So, friends, this brings us to the end of today's engagement. Really, we have seen that diabetes, the two forms of diabetes, the diabetes mellitus, the diabetes insipidus, the diabetes type 1, and how it is caused, the diabetes type 2. We have seen how to check for the blood glucose. We have seen the normal levels, etc. We have seen the causes and its etiology, the genetic predisposition in terms of type 1 and type 2, being autoimmune for type 1, also where the body is failing to recognize the beta cells, and for the type 2 we are looking at basically the lifestyle and etc. We have looked at the glycemic index, how the food are releasing the sugar into the blood stream, and how we could use this to our advantage, the game of the glycemic index and etc. So friends, I beg to end here unless there is an issue. Yes, it is.
Yes, thank you, sir. I came across a question as I was reading yesterday, the primary dietary goals for type 1 DM.
Pardon, you're breaking?
The primary dietary goals for type 1 diabetes.
Okay. So,
I have also some questions.
oh, okay. Yes, right.
Yeah. So to come across of the food that you can limit it to 8. Like I've seen that there is white bread. I don't know what kind of white bread you mean. Is it the normal bread in the market or in the kitchen or in the bakery room or not? I don't know. Second to that, there is what's so called olive oil and the nuts. What kind of that oil that is supposed to be eaten by somebody who sometimes avoid some of the food?
Okay. Thank you.
I was asking white bread and not
I will
plus
respond.
olive oil.
Yes. All right. To answer you this, we remember when we talked about diabetes type 1, we were talking of the autoimmune disease, right? And here, the primary goals for type 1 diabetes, we are looking at achieving stable blood sugar levels, and also while ensuring that the person is having optimum health. Okay, so in most cases, when we talk of dietary, we are looking at intake. Okay, so here things to do with balanced meals, things to do with the meal timing, things to do with carbohydrate management are all key. So basically, you could argue it around intake. You can't do anything else. When we talk of dietary goals, we are looking at intake. Dietary coming from intake. Okay, so here we are looking at basically the management of the carbohydrates, since we are saying these are the ones that significantly impact the blood sugar levels. Okay, so consistency in this carbohydrate intake also can help in stabilizing these blood glucose levels. When we talk of the balanced meals, here we are looking at a combination of all the macronutrients we know, the carbohydrates, the proteins, the fats, and also those we are saying when we eat all of these in this one. This can also slow down a little on the absorption of the carbohydrate. If we are giving the body only carbohydrate, then maybe we could lose out on that slow pace. But if we are eating balanced meals, then the body will be absorbing the carbohydrate slowly, and little by little will be seeping into the bloodstream. And also looking at the complex carbohydrates, you remember, I hope we know what complex carbohydrates are and what the simple sugars are. The complex carbohydrates are those whole wheats and whole meals and etc. So mostly what you're talking of when you're looking at the dietary goals, you're looking at those things you can do in dietary intake that can at least stabilize a person who is diabetic. Things to do with a person staying hydrated and etc. I hope I've answered your question, Eudes.
Yeah.
Okay. Then for right. Then for I don't know. I don't know how to explain this, but actually, most of what we have on the market is the white bread. Okay, but have you seen whole? Is it called whole wheat bread? Actually, it is brown bread. It's even not very sweet. Have you seen it in the supermarkets where you've been?
Yeah, well, I was not actually identify the oil called olive oil. In those oil that we are using. So to that, yeah, olive oil. So because we have many type of oil.
I can't get you clearly. Earlier on, I was hearing something to do with the.
I think we in our areas we also it's raining. So I'm saying there is a certain oil in the note. It's called olive oil.
Okay.
So I'm not quite sure what kind of that oil that is supposed to be eaten.
Oh, so when we talk of these olive oils are rich in monounsaturated fats. Okay. I think they have some of these anti-inflammatory properties, and also research suggests that these may help to improve the insulin sensitivity, okay, and regulate these blood sugar levels. So really, there is something to do with the olive oil, and also partly we could talk of the glycemic index that with olive oil, it has a very low glycemic index. And we talked of glycemic index that this one, if it has a very low glycemic index, then we don't expect any spikes in the blood sugar levels. So we are saying this olive oil is really a health solution compared to other oils, as it is still calorie dense. But other people could opt for other oils, but really individuals who consider this olive oil tend to be able to counteract these sugar levels from spiking. I hope I've answered you.
Yeah. I think I may still also want to explore more about the olive oil because now, yes, well, you explain it properly. But how can you see this olive oil is from what kind of oil? Because we have many different oil from different source. So I don't know this olive oil is from where.
Olive oil is from olives. Yes.
Okay. And then what is it? I'm still also confused on white bread.
White
bread, yeah.
The common type of bread you have is the white bread. The most common type of bread on market, that bread that you see being displayed on TV, the one that they smear margarine with, is the white bread. But then the brown bread, okay, give me a minute. Let me get you a picture. Are you still on?
Yes, I'm on.
Okay, let me get your picture. Be watching your screen.
Because we have different bread in the market from the
Yeah,
different
you're right.
kind of
Let
food.
me just get you. This picture.
From a different kind of food, there is a weight. The other was made with the weight. The other was made with maize flour, and then the other is made with what? Had I don't want to
Are
know
you seeing my
exactly because
picture? The picture I put on your screen.
yes, I'm seeing it.
Yeah. So this is a common bread that is on the market, right?
Yes,
Yeah. Then let me search for the whole wheat bread so that you can appreciate the difference.
because in the market there is a bread made with a, a wheat flour. Wheat flour.
Yeah, they are all made using wheat. So
Yeah,
this is our white bread. Uh,
I'm seeing it. I'm seeing it. The picture.
yeah. Then this is our whole wheat, what people call white gondi brown bread. So you're seeing the difference that this here on the right, here on the left, sorry, is more is what we have commonly in the market, and this that we have on the right, very few people want to eat this type of bread, really, and it's even a
Mm.
little sour. It's a little salty compared to this white bread.
Mm.
Yeah. So this is the healthier option because of the glycemic index, like we have told you, things to do with the whole foods. But this is highly refined. Okay, it is more from refined wheat compared to this, and you will see that
Mm.
the ingredients are different on the both of them. So for a diabetic individual, we could recommend this and less of this. Are we together?
Yeah, we are together.
All right. Then have a good evening, everyone.
Have a good evening too.
And